So a flat foot can be painful or non-painful. I see quite a few patients that will come in with a flat foot requesting orthotics, but they have no symptoms. There are a significant number of people that exist that have a flat foot that is not painful and it is not pathologic. Having a flat foot does not mean that you have a problem. It could just be your genetics. And the only time that we want to try and treat a flat foot is if patients have pain associated with the flat foot. A flat foot typically develops over time from an arch collapse that follows a very predictable progression. And so when somebody presents with a flat foot, they'll typically have pain on the outside of the ankle where the fibula bone, the ankle bone on the outside, is pinching into the heel bone as the heel tilts towards the outside of the ankle, or the arch tendon on the inside of the foot is starting to fail as the arch is collapsing and it's not strong enough to support that arch. When patients have painful flat feet, we can start out with simple orthotic modifications to try and help recorrect and redirect how the weight is hitting the foot, along with some stretching. If that fails, we could always progress to more aggressive immobilization in a boot or a cast. And if all that fails, we typically talk about looking at an MRI to evaluate the arch tendon, also known as the posterior tibial tendon, and for any other changes that could be contributing. And then we would then talk about surgery if you failed appropriate conservative care. There's two main ways to treat a flat foot surgically. You can do one where you try to cut some bones and realign them without fusing joints or forcing bones to grow together at a joint space. And so we could either do a joint sparing or a fusion type operation to correct those. And really what would be best for you is kind of based upon your symptoms, the severity of the deformity, and your physical exam findings along with radiographic imaging. But overall, it is a fairly sizable reconstructive surgery with a reasonable lengthy recovery. If we do osteotomies, it roughly is about 6 weeks for those bones to heal. It almost always involves transferring a tendon to take the place of that arch tendon that has gone bad. So we borrow a tendon from your toes and reroute it and rebuild that arch tendon with that. And then we have to build the arch around that new tendon. And so we have to, one, get the bones to heal that we have realigned. We have to let the soft tissue heal and then start physical therapy. So I tell patients, depending on what we do, usually it's 6 to 8 weeks non-weight bearing, and then typically some progressive weight bearing in a boot. And then once things look good, we'll start some physical therapy around the 3-month mark. Any major surgery like that, if it gets to that point, the total recovery time is about a year. Even if we've got you started in therapy around the 3-month mark, these are lengthy recoveries.